What's up, guys? We've done 3 reviews of The Good Doctor already, but we haven't even seen season 2 yet, so let's start it up. Season 2, episode 1. Dr. Sean, I'm coming for you.
This will give me at least 10 more years.
Should give you 10 more years, yes. Elliot, I understand your concerns, but...
And Dr. Melendez is one of the best cardiac surgeons around. Dr. Andrews told us all about you when he convinced me to come here for surgery instead
You
of...
spoke to Dr. Andrews?
And they both already spent half the morning raving to the press.
Well, that's very kind. You spoke to the press? You spoke to the patient, my patient.
As I explained to Elliot and Melanie, the press attention is a necessary element for funding this surgery.
There's a fine line with doing this type of press and exposure. And I understand that line very well because I try and balance my professional life as well as my life as a social media person very diligently, to put it nicely. Sometimes medical systems forget about that line. They forget about that the major mission that we're involved in is helping humans. And while yes, we want to get a better surgical center so we can help more people, we want to create funding for our hospital, notoriety for our hospital. The question needs to be asked is, at what cost? Did we discuss this with our patient? Are they on board with having this type of press happening? Is this fair to them? Are we taking advantage of them? And only until you answer those questions, only then you can go ahead and do all this press and notoriety for your hospital. Oh my God, is he having meningitis?
It's stiff.
A stiff neck could be an early indicator of bacterial meningitis.
There are many possible explanations for a stiff neck, most of which are much more likely than bacterial
If the
meningitis.
abscess has invaded the meninges of his brain, it could be exacerbating his paranoia.
So bacterial meningitis is inflammation of the meninges, the soft little padding that's found between your brain and the skull. This is quite dangerous because the area inside your skull is very limited, so that if you increase pressure, you could actually harm the brain and do damage to the brain. On top of that, that infection can spread from the meninges to the actual brain, to your blood, and cause you to become septic. It's a very dangerous condition that needs to be treated urgently. The way you diagnose it is you go into the spinal cord through a lumbar puncture, and you see and you study the spinal tap. So you see if there's white blood cells there, if there's bacteria in there, you do a culture, if there's blood, and it basically points you to if there is a meningitis, what could be the possible cause of it? And then right away, you gotta start being as proactive as possible, starting all the treatments and backing down once you have the guidance as to what the likely cause of the meningitis is.
Hey.
Melanie has an aortic aneurysm.
2 hours beating into that.
Yeah. Not so good.
So I've talked about aortic aneurysms on this channel in the past, but basically what happens is the aorta is the major blood vessels that comes out from the heart that allows it to bring blood to the rest of the body. If you have an aneurysm, you basically have a weakness within the wall that allows ballooning of the last layer of the artery, which means what? If you have more pressure, meaning 2 hearts beating at the same time, you could actually rupture the aorta, and what happens? You bleed out internally and you die. Perhaps they can fix the aortic aneurysm first and then do the procedure. I don't know how critical this patient is right now.
It was my medical opinion that he could have bacterial meningitis.
And if you're right, then I owe you an apology. But if you're wrong, then I will be on the phone to Denver and I will make your life infinitely more complicated than you think you're making mine.
Why is this such a manipulative situation? For God's sakes, there's a patient's life at stake who could have bacterial meningitis. You're saying if the doctor's wrong by playing it safe, you're gonna give them a bad review? I feel that one of 2 things is gonna occur. 1, it's gonna be viral or aseptic meningitis, which can happen. Or 2, by bringing him in and doing all of these things, they're gonna find out that he has another issue that had they not brought him in, he would have passed. Let's see if my prediction is right.
Harry has kaleidoscopic disintegration. We thought he had
What?
schizophrenia, but he does not. He has a brain tumor.
This is why you send patients to the ER, because in the ER, with all of those symptoms, in addition to getting a spinal tap, they would have done a head CT and likely done it with contrast to see what's going on inside the brain and would have seen something like a brain tumor. but I don't know what kaleidoscopic disintegration means. Even if he's right with the brain tumor, this is a guessing game. This is not how medicine is practiced. Kind of ashamed to see this because in season 1, they were so medically accurate in making these diagnoses and how it happens. But here, just because he's finding some symptoms and he's getting these wild theories, did you do a drug screen? Did you see if he's anemic? Did you see if he has a major thyroid tumor causing excess thyroid hormone and that's why he's bouncing around all over the place? There's a lot of things that need to be ruled out, Sean.
Have you seen Harry? He lives in a... We need to find Harry. You don't...
So those who are diagnosed with autism sometimes have a condition where if there's overstimulation, whether it's lights, sounds, even stress, they can sometimes be overwhelmed like this. I totally sympathize with Sean, what's happening here, because he's trying to do the best for his patient, but clearly it's a struggle.
You have a neurological condition too, but yours can be cured.
I appreciate the sentimental value here, but he doesn't know that. What if it's a malignant tumor?
You just need some surgery, then you can be Edward Austin Thomas again.
You just need some surgery, just some surgery.
Knife.
Someone pay attention to the monitors on the show. She's flatlining there. They haven't even made the incision yet, and she's already flatlining.
Edward has a right parietal brain tumor.
Find Dr. Lim, you can have OR number 2.
That's not an emergency operation. When you need surgery, you can go one of two routes. You can go planned or you can go emergent surgery. For example, if you come in with a level 1 trauma where you got shot or cut inside your abdomen and you need to find the source of the bleed and shut that off, that's emergent surgery. You're not gonna get a lot of pre-testing done to make sure the patient's capable to get through that surgery because they'll die otherwise. So you wanna just do as best as you can in the given moment. But in this scenario, this is not urgent. This patient has lived for a while with this tumor and been fine. Perhaps it's best to do some pre-surgical testing, figure out if we can optimize them medically, meaning get them on some medications, lower their blood sugar, control their blood pressure, clean them up.
Now we just have to wait to see who wakes up, Edward or Harry.
See, that is realistic. There are certain tumors, depending on where they're found inside your brain, that can totally change certain aspects of the way you behave. For example, the frontal lobe is what's most important for decision making and control over your urges. So it's not uncommon for a patient who has a frontal lobe tumor to start acting differently, becoming more risk tolerant, meaning that they're gambling more, they're having more sexual relations unprotected, cheating on their spouses, and then no one knows what's going on. Only until they get properly examined do they find out that they had this tumor the whole time. Being happy and healthy.